what's special today's science is every individual has got a variation. No two individuals have exact same anatomy inside. The technology, the biggest impact it will have in the times to come, like we don't care about the pilot who flies the plane when we get in, we should not care about the surgeon who operates. So the recovery is faster, the pain is so much less, and obviously the God has designed this human body so beautifully. Every part is very, very useful. The most exciting times for a surgeon, nothing can be more reassuring than to superimpose a pre-printed image virtually on a patient's body in the operating room.
Hello and welcome to the New Indian Express Online. I'm Bansy Kalappa. With me is a very well-known guest. We have with us a medical entrepreneur, someone who is the chairman of SPARSH Hospital. We have with us Dr. Sharan Patil. He is also the Chief Orthopedic Surgeon here at the SPARSH Hospital. Well, Doctor, welcome on this program.
Thank you for having me. Yeah.
So for years, medical science has been a mystery, and especially when it comes to surgeries, people have always wondered what is below the skin. And this has been the Indian medical man's big problem right from the time of Sushruta and even Charaka. But nowadays, people seem to have a better idea of what is below the skin, especially when you're going in for surgeries.
Yes.
Can you explain how?
Yes, that's a very interesting question. There's no doubt even the ancient medical science always had different ways of finding out what's underneath the skin. There are two aspects to this question. One is what actually physically is there underneath the skin and how the human body functions. There's been tremendous advancement over the years, and now we know it more and more clearly. When we talk about advancement in science, it's also advancement in our ability to know the functioning of human body and what lies underneath. What's special today, today's science is every individual has got a variation. No two individuals have exact same anatomy inside, or the body doesn't look the same inside. That we are able to personalize it. We are able to know exactly what is there. So our precision has become multifold, so much better. That's the beauty of today's diagnostic tools and the science.
Okay. Now, knowing what is underneath, does it make an impact or a change? That prior knowledge, does it make a difference?
Of course it does. It does a tremendous difference, I would say. So if you are not aware, medical errors form the biggest complications in medical science. We don't have great data and statistics in India, but the American statistics clearly shows the biggest percentage of complications for anything we do are out of medical errors, a lack of judgment. People who are familiar with medical science and the anatomy and the books we read, every part of our body is color-coded. The arteries look red, the veins look blue, and the nerves look yellow in the anatomy book. But we as surgeons, when we get inside, all we see is blood and we don't see any color-coded stuff. So it makes it so much more difficult to work on something which we know theoretically, but when we go inside the body, it's not there. So this clear understanding prior and the variation in every individual's anatomy is the biggest help, and this will decrease the medical errors and complications in a very big way. I can just add here, for an experienced surgeon, I've spent 30 years operating. For an experienced surgeon, probably we have had a learning curve, we have learned out of the errors, we make less and less errors as we are more experienced. But my concern is this world does not have time for 30 years of experience to do the perfect job. I would like to think a freshly graduated surgeon also should do equally good job as an experienced surgeon. The reason I say that is, why should some human life be subjected to somebody's learning curve?
Absolutely.
And for me, the technology, the biggest impact it will have in the times to come, like we don't care about the pilot who flies the plane when we get in, we should not care about the surgeon who operates, because everybody is hugely assisted with technology and the knowledge, what is there inside. The planning can happen before, and it's question of execution, and technology will hold us in the right path so that we don't make medical errors. And for me, that's the biggest leap the medical science will have in the times to come.
Nowadays, they're speaking of something called 3D printing.
Yes.
And they say that apart from artificial intelligence,
Yes.
3D printing is something which has greatly assisted surgeons.
Yes.
So what are the different kinds of 3D printing, and is it of any use to you?
Absolutely, absolutely. I'm in love with 3D printing. Of course, 3D printing has invaded every walk of life, so it has in medical science. What's amazing about 3D printing, any part of the human body, we want to study it in 3 dimension. We want to touch, feel, move around and understand it in multi-dimensional way. Of course, the CT scans and 3D reconstructions, but they're all on a flat screen. To have it in the hand, touch and feel, and know exactly how do I reach that spot and what do I execute, that planning is so possible with 3D printing. There are different kinds of 3D printing. There's something called as a monofilament and polyfilament and resin printing. These are all different kind of printing. Some of these 3D printed models help us rehearse the surgery even before we execute. What's even more intriguing is the resin printer, what we have, we can do jigs, by which I mean guiding jigs, which we can use inside the operation theater on the patient's body, because they're all sterile, and use them to make some precise surgical movements and cuts and taking the tissue out. This has done 2 things. One is we're very precise, and we take off the entirety of what we want to take off or what we want to do. Second thing is we do not overdo it and cut the valuable or good tissue just for being safe, because this defines everything so precisely. These 3D at SPARSH, what we have now is pretty much all of this in its entirety can be done in-house, right here, right now.
Do you have something to show?
Yeah, surely I can show that. I can give you an example. This is a 7-year-old boy, and this is how a forearm looks. This is how this is the right side. Forearm looks like that. And it was easy for us to know that on an X-ray and with the symptoms and all of that, this gentleman had the bone is not a normal shape. This bone had become bloated up. It's a very sure sign of, this was biopsied and found to be cancer. And when it's a cancer, and quite often in some of where you don't have precision, they talk about taking the arm out, and that is such a debilitating procedure.
Painful, yeah.
So all we did was did the scans of this, and we say scan in the morning and plan in the afternoon and execute the next morning. So it's as crisp as this because everything is in-house. So we scanned this and we printed it and planned it and executed next morning. What did we do? We knew exactly where that tumor is and where the blood vessels are running right in front. It will clearly tell me where they are. So I need to know that this blood vessel need to be moved out, and precisely the whole tumor can be excised. What we did with this boy, and what's even better, when we go inside, this gives us so much of precision. We also printed out a jig. This is a jig. We understand jigs are used to be very precise. We could use this jig and place this whole thing on his bone. And when we place it on his bone, we have got the slots through which we can use our saw and go and cut it. It will precisely remove what we want. And the impact, overall impact what we had is so tremendous. This boy's tumor is taken away and his arm is salvaged, and he can pretty much lead a normal life.
So he doesn't have to amputate his arm like someone told him in Delhi.
Absolutely. So there is the effect, the impact is quite tremendous. Yes.
And because of the precision,
yes,
I guess the healing is that much faster.
No question. One of the biggest things when we as surgeons go in and operate on human body, anything we do is obviously mutilating to some extent. How the difference between a good surgeon and not so good surgeon is how he handles the soft tissues and how minimal collateral damage is done to the body and the tissues. So because of this precision, we don't dissect beyond what we need. We don't touch the tissues and harm them beyond what is really required. So the recovery is faster, the pain is so much less, and obviously the God has designed this human body so beautifully. Every part is very, very useful. Absolutely. So we are not touching anything where the pathology is not there. Absolutely. So it makes the world of difference what we do. Yeah.
Okay. Yeah, but doctor, does that solve the problem when you need to remove an entire portion of the body? Is there something that you can use as a substitute, like an implant?
Yes, that's a great question. So I'll tell you classically. Here is a model. I'm sure you all your viewers can recognize
dental implants, lower jaw.
This is the mandible. So it's not infrequent when a part of the mandible has to be removed because there is a tumor in it. There's no way we can salvage that. So when we remove that tumor, we need to maintain the shape of the jaw and teeth to be implanted on that. So we need to precisely have an implant in its place. This implant, everybody's jaw size is different, and you cannot do it inside the theater. So what we do is we take the images, reconstruct it, and this implant is customized to this person, and it precisely goes and sits where we want it to sit. And this is printed ahead of time. So this implant is 3D printed and it is customized. We go in, remove it precisely with the jigs and take this and put it back. Cuts down the operating time dramatically. What would take 4 hours would take half of its time. In 2 hours, we can complete the surgery. And it is so perfectly sitting there, the adaptation for the face and the human body becomes so much more easier. And that's the beauty.
But does it work only with the jaw, or can it work with other parts?
Absolutely. There are multiple areas we use this. Me being a joint replacement surgeon, sometimes we do joint replacements or there's some destruction of the bone. So the pelvis, what you see, and this is typically the socket. But what I'm showing now is from a patient whose socket was destroyed. Now, normally when we do a joint replacement, we put a socket here and then put the hip. But in this case, the normal socket would not fit here because already the bone is destroyed. If you try to put a normal socket, it will never work. So what
the person would be immobilized for life?
Absolutely, not be able to walk around comfortably. So it's a disastrous thing when this happens. So what is possible today is without going inside the body and figuring out what is wrong and what is to be done, we take a 3D printer and then see the contour, the destruction of the bone and everything else, and put it in our system where an implant is printed, customized to the need. So this is typically an implant. Normal implants, this is the socket. Normal implants don't look like this. So this is a socket which fits in so perfectly here. And we know where each screw goes, how it, so much of medical science and orthopedic is carpentry. So if we have a precise fitting socket, this will last for 20 years like this. If we do not put it precisely, it doesn't work. And it is so accurate. The technology today is so accurate. 99.9% is the accuracy. If I do this printed and I go into the human body with this and I put it here, the mismatch is less than 0.1. So you can imagine what kind of luxury the surgeon can have, how little the mistakes can be, and how well we can do this.
Amazing. So these are titanium implants.
Absolutely right. These are titanium implants. Okay. Like we keep talking today, 3D printing, you go online and book a 3D printer, you can get it in 20,000 rupees. But what we have in our lab are something very, very sophisticated, where there's a process called segmentation. A lot of software, a lot of other things go into it to convert the images into understandable or reproducible 3D printable kind of situation. That is the differentiator. To have something in-house, in the past it would take weeks to get something like this done while the patient waits. Today, at our organization, like I said, it can be done in 24 hours. Execution can be done. Yeah.
Also, doctor, what is the future? How will this technology go from here?
The technology has got no limits, and possibilities are amazing. Even as we speak today, what I'm talking is 3D lab outside the operating room where we print this, do the implants and all of this. Virtual reality and extended reality is what we are talking about. So whatever I'm talking about, playing around with models, that can be done with the goggles with a virtual reality or an extended reality, we have started calling it. And we could play around with these images virtually. And we can superimpose this virtual reality or extended reality onto the patient's body while operating. So if I'm operating, the images are superimposed on the real patient who's lying there. So I'm operating with this camera, which will tell me precisely where I am. So the most exciting times for a surgeon, nothing can be more reassuring than to superimpose a pre-printed image virtually on a patient's body in the operating room and know exactly where I'm going. It'll navigate me to perfection. I think that is the greatest service we can do to the people who come to us, and that's how precision science can be delivered.
So, what is this special help or equipment that is used in surgery called the AI goggles?
Yes.
What is this?
Yes. So it's very interesting. This is a 3D surgical goggle, as you can see this. So once you wear this on your head and you see through these goggles, you can pretty much see the entire 3D printed model. And when you see that, in fact, it's exactly like a video game after that. And most of this technology, by the way, has arisen out of advancement in video games.
Wow.
So you can hold this and pretty much move the model around and see it from every angle.
So that's like a joystick.
Absolutely. This is exactly like a joystick. You can even measure the distances. You can do wonderful things with these. This gives you that you don't have to imagine too many things once you have these things in hand. That's how it works. And what's even more interesting is multiple people sitting out of multiple places can see the same image at the same time and have a great conversation as to what is the best way forward and how can we do this. That's the beauty of virtual reality. It can be multiplied. It can be seen in different places. Yeah.
Now, how difficult is this 3D printing lab?
Yeah.
And can every hospital afford it? Because you have so many clinics in remote areas which don't have the wherewithal.
Yes. No, it's absolutely not necessary for everybody to have it. These 3D printing labs are expensive. It's not easy to set them up. Having said that, it's absolutely not necessary. Today, we can do a 3D printed model or create a virtual model, distance agnostic. Somebody can send the images of the body, the scans which are done anywhere, from Africa to Jayanagar to anywhere in India. They can send the images. They can be converted into virtual 3D printed 3D images, and we can play around with them, and that can be transmitted back to the places where they need it, and they can operate in their place with this. So for your question, there's absolutely no need for unnecessary duplication. Multiple people can use the same one. For example, we have multiple hospitals in Bangalore. All our hospitals use only one 3D lab, and all of us are not experts in everything. Sometimes we need opinions. We need to discuss this. Somebody in Japan may be an expert. Somebody may be an expert in America. We can, maybe in different continents, we can bring them all together and discuss this problem. I truly believe, as a philosophy, for a patient, what's not important is what I can offer. What's important is what that person's problem deserves. I truly believe in the combined wisdom of the medical fraternity to deliver the best for the patient. One, I'm a strong believer doctors should have the least amount of ego and more amount of combined wisdom of all the wherewithal, because if we love our patients, we want our patients to have the best.
Absolutely. Thank you.
Thank you.
So there it is, Dr. Sharan Patil explaining that 3D printing, this is really rescuing hundreds of patients. One, the length of surgery is shortened. Number two, those tissues which otherwise could have been compromised or removed, they are not done so. And these tissues which are removed are only the seriously affected areas. And number three, the patient can get to walk out much sooner than expected. Thank you for watching.